It is needless to say that it is very difficult to get a job as a nurse overseas. So today we're going to have a short conversation with a ICU manager working at tertiary hospital in Canada about what are the key factors to consider when you're getting a job, when you're applying for a job in Canada. So hello.
Hello.
Hello, hi. So thank you very much for your time today. Would you please introduce yourself just briefly?
Sure. My name is Chris Kutnick, and I am a manager of a tertiary care cardiac intensive care unit. And I've been doing that job for the last 2 years, and prior to that I've been a critical care nurse for probably 25 years.
That's great. So you've been in this nursing field for close to 30 years now.
Yes.
That's great. So just a quick question about the job, except like employment process per se. Because in Korea, when you apply for a job, sometimes the director of the hospital comes and then they interview the new grad nurses, or sometimes the head of the nursing department comes and they do have an interview with the new grads. However, how does it work in Canada? Are you actually the one who accepts the applicants?
So the international nursing process, I think, is a little more complex. And so as a manager, I probably don't have a lot of input into it, only because one of the things our human resources department would require to get a job would be a Canadian license. And so our human resources department, as well as myself, really don't have any input into how you apply for that Canadian license or that Manitoba nursing license. So that piece is done very much between the nurse and the College of Nurses in Manitoba. So when I get an application from a nurse that's international, has applied to my positions, one of the first things I do is when I look at their resume is look at whether or not they even have a Canadian address. Because if I see they don't have a Canadian address, I already know that I'm going to be forwarding that to our HR department to reach out to tell them how to navigate the system to get a license. So if I see they've had a license somewhere else on their resume, I might reach out and then see whether or not they've approached the College of Nurses in Manitoba to start that process.
So you're saying that because we're in Manitoba, and then if you're getting an application from any other provinces who already have license in any other provinces, it would be much easier to get the jobs in Manitoba.
Yes. Yeah.
Alrighty. So then my next question would be, let's make it easier, okay? Let's just say there's a person who is in Korea, already have a license for Manitoba. Let's say she has a Manitoba license.
Okay.
And let's say she applied for a job. What are the things that you first look at when you get the application? You told me about the addresses and everything.
Yeah.
Any other particular things that you look at in terms of skill-wise?
So, yes, I think one of the things that's really important is that your resume is very clear on your clinical skills and your abilities. So what might your experiences been? Are they caring for patients who have IVs, wounds, maybe other things like drains and tubes? Do you have a specialty in palliative? Whatever your specialty is, you want to outline. And again, it shouldn't have to be very long. It could be a very brief bullets of what your experiences are. The other thing that I look at on a resume is your work experience. And it should be laid out very clearly what those units might have been. So perhaps, and here's a good example, maybe you were working on a medicine unit, and you might put down your latest experience as November 15th of 2022 to present. And it might say inpatient medicine unit. And then underneath there, you can put brief bullets of what your responsibilities might be. So you could put, my responsibilities would be to care for a patient assignment of 4 to 5 and include these skills. And then that's what you're sort of looking at. Where it's difficult is if people we don't look as much at student experiences. We
Right.
want to know what your experiences are as a registered nurse.
Mhm.
So brand new nurses that have just finished nursing school often write all of their clinical
Mhm.
rotations that they've done. That's okay, but where I would look as a manager is like, where's your current workplace?
Mhm.
What are those what are the skills that you do there?
Mhm.
And that your resume is very clear on that. So sometimes people don't put their work experience very clearly.
Right.
And then, if you're an external applicant,
Mhm.
that might be one way that I might not look at you as somebody who has a very nicely laid out resume
Right.
that gives me a very clear indication of what you are as a professional. Where did
Right.
you go to school? What were your last places of employment?
Okay.
What were the units and what was the skill set that you had
Okay.
from there?
So literally just pinpoint the key factors, key responsibilities that you have taken as a nurse when you're working.
Yeah.
So when it comes to experience, there's so many nurses that have experience in, say, tertiary hospital, experience in only like in clinic, like a walk-in clinic, or like PCH, personal care home, right?
Yes.
So when you look at those key outlined skills that applicants have, does it really matter where your work experience is from?
It does. I think it does.
Mm-hmm.
I think if you were coming to, and again, we're critical care, so critical care is a little unique. You have to have had critical care experience to even be considered in critical care. But if I think about more general opportunities to come in, and that might be an inpatient unit, if you worked in a clinic, were you able to manage and organize care for 4 to 6 patients? Could you do assessments, documentation? Are you able to prioritize? Are you able to critically think? Are you able to escalate concerns through the proper escalation protocols of a facility? Because if you worked in a clinic and you only saw one patient at a time,
Right.
settled them into a room, did a set of vitals,
Right.
that skill is not transferable to an inpatient unit.
Right.
You would need a lot of orientation, a lot of onboarding that somebody may not want to offer.
Right.
So you really have to think about the environment and your skill set and what's expected of you where you're coming. And that's where sometimes the research would be key to look at. What are you applying to? And is the skill set that you have going to be transferable to the environment of the unit you're considering?
Okay, I see. Because when you're working in the clinic, it's limited. The skills are limited.
They are.
Critical thinking is limited.
It
Pretty
is.
much, right?
Yeah. And it's a very controlled environment. Patients are walking in to their appointments, so they're always very stable. They're not coming in with an acute concern of an illness, along with 4, 5, 6 other of your patients who are also there.
Right.
So time management is key.
Also key.
So you have to really look at what is it that your skill set is currently, what is it the unit that you're applying to, and what is demanded of you. And that's where a little bit of research yourself. Because if you're coming from clinic and you don't want to be in an area that's 4 to 6 patients, heavy care, total care, and fast turnover, maybe that's not the right place for you to apply. Maybe you need to be looking a little closer to where you're applying to something that might either your skill set or where your future intention is as well. And how are you going to get there? Are there things that that you need to work on to get to there?
Right. It's because I think that may also limit the possibility of getting a job as a nurse applying from overseas. It's because that many clinics in Manitoba or any other places, clinics in Canada would not really consider accepting applicants from overseas because there's so many applicants in Canada already, right?
You're right.
Okay.
You're right.
So you're saying basically just review skills you have and then look at the jobs if that meets the
job description. Really,
the
you
job
have to look.
description. Yes.
Because sometimes it's hard in some of our our online job board or where you apply, unfortunately, sometimes the description, the heading description is very vague. I get lots of nurses without critical care that apply to critical care jobs because they see, oh, it's a nurse position in a unit.
Right.
And then they don't realize through the job description,
they don't really look at the job description.
The critical care is a requirement. And so those, by default, when I look at a resume and I see that there's no critical care, those ones I automatically forward to our HR department and say, perhaps follow up with this person, see where their skill set might be better suited to.
So then, because you're in ICU, what if you're a ward manager? Would you consider them?
I might. Here in our site and in our region, what happens is that internal applicants are obviously considered first. So if there's no internal applicant and now you're what's considered an external applicant, you need to sort of give me something on your resume that even makes me interested in reaching out to you. So if it's poorly written, I can't get a sense of what your skills are, what your experience are, I probably, unless I'm somebody who has a high vacancy and I think, oh, maybe I should look at them, or today's a busy day and I'm just going to pass you over.
Right.
So you need to sort of sell yourself and give me something that would appeal to me. So a nice, like I say, nicely clean, well-written. Your resume should really never exceed 2 pages.
Okay.
Including
the cover page?
Cover pages would be separate. Don't reiterate what's on your resume. That is your opportunity to sort of write me something that says,
introduction.
Hey, I'm here I am. I'm a skilled clinician in what have you, and here's some of my skill set. Please review. You'll see by my resume that I have the skill set you're looking from the job description. I look forward to hearing from you. And then that resume should be no more than 2 pages.
Okay.
And again, if something is from 15 years ago, is it really relevant to the resume? You should be really looking at what are those last 4 or 5 years. Even if you've been nursing for 15 years, where have you been the last 4 or 5 years? If something was 15 years ago and you worked in a acute medicine, but your last 5 years has been as a clinic nurse, right?
Not really.
Yeah, it's not relevant again. Be mindful, right? Because if you're 10 years away from a hospital, that's a very long time.
You literally lose everything.
You do. Yeah, you do, right?
A lot of nurses in Korea who is looking into coming to Canada. There's also new grads. However, there's mother or father who is trying to come to Canada, but then they do have an experience, like say 10 years ago. They don't have any experience recent 10 years, and there's a big gap. And then a lot of people ask, would I be able to get a job in Canada? Well, I have a license, but I don't have experience. Would I be able to apply even? So what would you say to the people who's in that situation?
I think you'd have a really tough time getting a position if you have not had any experiences for 10 years. And you may be out of the workforce for many reasons, caring for raising children, helping out with family, etc. 10 years in healthcare is a long time to be. It changes a lot.
That's right.
I think you'd have to be mindful of where you're applying to again. So if you're 10 years out, but I see nothing, you haven't taken your CPR, you haven't taken maybe a refresher class, have you attended a course that shows me something that you've kind of kept current in 10 years,
That's right.
you'd have a difficult time. I will say. And that may be where you might have to entertain going to somewhere lower acuity first, and maybe a place like a personal care home versus going to either a community hospital or for sure tertiary care. Because if you're 10 years out, I don't know that many tertiary care facilities will say, come on in.
That's right.
That's a long time.
You're right.
It's a long time.
I was going to actually ask this question later in the interview, but then now that you mentioned about this, the opportunity, would they have a chance to get a job if they apply in rural hospitals? Say, I know there's a big hospital in Dauphin, I know there's other big hospitals in like Russell,
Yeah.
that kind of places.
Yeah.
Would you consider applying those hospitals to get a job with no experience within 10 years?
I think you could attempt. 10 years is a very long time.
5 years?
5 years, I think. 10 years, when you think about it, that's a long time for somebody to have. You know, if you think of even equipment, right? Like our IV equipment in 10 years, pumps in 10 years, the fact that you haven't touched a patient in 10 years, do you remember how to do a full head to toe and document? Now, having said that, I think, you know, there's never a never, right? I do agree that the rural places, and if you have a high vacancy and you can really polish up that resume and show that you're keen and eager to learn, and reach out to a manager and do that. I don't know that no is ever an answer. I think when you have, you know, high vacancies like we do now, I think employers are open to somebody coming in, and I'll just say many places do have, as an external coming into an organization, there's sort of this usually a 90-day probationary period.
Okay.
Which is almost a safety net for the employer, because if you come in and in 90 days, you know, you're not able to show me that you have a minimum of a skill set and that you're progressing to be, you know, a safe practitioner. I think that's an opportunity as well. So again, back to that resume, back to selling, and what is it in the last 10 years you might have done that you could write those words? So maybe had you been caring for family at home, you know, did you do anything? And this is maybe a tip for future people who want to take that time off. Maybe you need to think about once in a while just keeping a shift here and there. So for future people, it's a long gap in a career that on a resume, it's a bit of a warning to a manager that says, "Ooh, that's a long time. I don't know if I want to invest." Because there's a lot of investment for the organization to get you back to that basic.
Now that I hear from you, I'm gonna have to tell my wife to rethink that getting a
You know what?
nursing license here.
Maybe not. I think some of it is, you know, is there opportunity in a refresher? Right, in courses, what is there out there that can sort of help you to brush up on some of those skills?
So now that you mentioned about the refresh course, in my case, I had a refresh course in EPC.
Yeah.
And then there was a 1 month practicum in Canada, experience in Canada, right?
Okay.
That was the PCH, personal care home. Would you consider that as an experience? Because I was a student.
Yeah, but it's current, right? And then I think the other thing you would want to have is there a bit of a reference from that instructor that did that clinical with you?
Yeah.
I think recently I'm just hiring a healthcare aide who really, he did a practicum here.
Good.
And his instructor wrote off on his evaluation, how he did, what he did. And that evaluation and that reference was worthy of getting hired.
Right. So in short, when applying, just pinpoint, make sure that your skill sets, make sure that you can do this and this and that, make sure to make it clear. And also current experience would be very important within at least 5 years, or just a gap would be like the maximum gap would be 5 years of no experience, you would say.
Yes.
And the other thing would be you guys would probably prefer experience in Canada rather than any other countries.
Yes.
Right.
And I'll tell you the reason for that, and I know this from being an instructor in the past. Nursing in other countries is very different than nursing in Canada. In Canada, you know, you're doing a lot more primary care nursing. So you're not only doing assessments, documentation, you're doing the medication administration, you're doing the vitals, and then you're giving that information. In other countries, some international nurses don't do the vital signs.
Maybe different.
They don't know how to do a blood pressure because that might have been a physician role in their country. So again, knowing what the skill set that's required of where you're applying to, and then making sure that your resume speaks to that skill set that's required.
In terms of the application, lastly, you know, there's so many things that we put in that application. So there's one of the things that we put as a Canadian status, like do you have a work visa? Do you have a permanent residency? Would you consider that when you are looking at the application?
I don't, because that really is more my human resources department. So in any facility that has a human resources department, that human resources department will make sure all of those little bits are done. And I think even from there to get a Canadian license, they're doing some of that work in the background.
Right,
So
okay.
by the time you get to me as a manager, I really want to know, do you have a Canadian license? And I can tell because I can go on to the College of Manitoba and I always check, does somebody have a license? Because I can put anyone's name in and see, do you have a license? And then I'll look at your skill set and whether it suits what I have. The rest, all of that other permits and stuff, that's done by HR. That's in the back. Yeah,
right.
not me as a frontline. That's sort of the background
That's
of a
right,
human resources
You already
department.
You already have too many things on your shoulder anyway. So
Well, I think it's such a level that's sort of, you have to separate. I'll be the expert to know what I need from a clinical perspective, and I need you to have a license and
you're right.
what your skills are.
Right.
The other pieces like that, that's the expertise of human resources. Are you Canadian? Do you have a work visa?
Right.
Do you have a social insurance number?
Right.
They do all that background piece.
You got it. The other thing would be, okay, let's say that you have seen the application and it looks pretty good, say, this person has an recent experience in Korea per se, good resume and everything, you decided to take this person. Do you interview them yourself?
If they're an external candidate and they apply for my job, yes, I would do an interview, and I would also need references from a current employer.
Okay, perfect. The reference has to be in English. The interview has to be in English, obviously.
Yes.
Of course. Any good tips for Korean nurses?
That's a great question. I think if I look at what I would interview a nurse, I'd want, the first thing would be, tell me about yourself, why you applied for the job, and what makes you a good candidate. That's always a really top piece, and that's your opportunity to sell me. The other things are probably going to be in terms of interview questions. When I interview an external nurse, I ask usually experiencing questions. So it might be, tell me about a time that you had a patient that wasn't doing very well. What were your actions and what was some of your follow-up? Then I might ask a question about conflict. Tell me about a time you dealt with conflict, either with a family, a patient, a coworker. I'd ask you a little bit about, tell me about some of the skills and experiences, and tell me about the patient populations you might have looked after. In critical care, I often do ask questions about, did you care for mechanically ventilated patients, and can you tell me about some of the modes you used? Tell me a little bit about some of the drugs that you're familiar with and how you use them on patients. I might ask about a time you had to deal with an emergent or urgent situation clinically. What was it? What did you do? And would you do anything different?
Right.
So it's really trying to get a sense when you interview, what do you like as a nurse and what was the experience? So I'm going to tease out a little bit more than you might have put in your resume. And you do, because it's easy on a resume to put some bullets. It's you can think about it. But as a nurse, you're having to deal with in the moment.
Right.
And the interview is just an opportunity for me to ask, those kinds of questions. Tell me more scenarios and looking to see what your story is, what did you learn, what kind of assessments, were you using a nursing assessment?
Right.
I made an assessment. I developed a plan.
Right.
I implemented my plan, and then I evaluated. So the nursing process.
Right.
And then another question might be, if you got this job, tell me a little bit what you think your biggest challenges are. And again, it's trying to tease out a little critical thinking, a little bit of assessment skill in an interview.
That's great, because now I'm working here in Canada for 8 years now. The key thing that we consider would be a teamwork.
Yes.
Now, when you're interviewing person, not only you're asking for their experience, what they have experienced when they were working, but also as a person, how would you cope with all these problems?
Yeah.
You're looking into more like a holistic kind of picture in that applicant. Is that right?
Yes.
Yeah.
And you're looking to see too, I think a lot of times what I look for, key things I look for in an answer are maybe they didn't know the answer, but did they communicate and did they use their team? So, I admitted a patient who came in on a new ventilator mode. And so I sought out, I made sure I worked with the respiratory therapist. I asked him to do some teaching. I checked with my charge nurse. Or in the conflict question, if I had a conflict with a patient or a family member, did I then communicate that to my CRN, and did I communicate to my manager? Or are you just telling me answers that's just about yourself, and there's no work on advocating, communicating, teamwork, escalation, those types of things?
I see. We're almost done with this interview here.
Okay.
So my next question would be, what would be the key thing that you would not pick that applicant?
I think you mentioned a couple already. I think that very long gap in employment is typically a really warning sign. There's such a long gap. I'm not sure that the time I need to invest, are you better off to go to school? I can't reteach a nursing school with 10 years, right?
Yeah.
We have limited ability to do that. I think that's always a warning to me. The other thing that's always kind of concerning to me, and you do have to be honest in your resume, but people who are in places for 3 months, 6 months, 2 months, and I look at that resume, to me that tells me, why are you jumping around so much? Is it because you just get bored and you move on? Is it that you've had conflict, you've not managed to settle in But those are usually warning signs when you see that people move every sort of so many months. And again, it really does come down to saying that you need that nursing license, right? For me to consider somebody, even if we have a great conversation over the phone and I think, wow, this could be a really great nurse, I can't help you through the Canadian licensing and Manitoba licensing.
You can't, no.
I just can't as a manager. I have no control over what happens out of there.
Of course,
but those would be a couple of things I think that would tell me. And I think your skill set too. So as an ICU, I would never, if you worked in a clinic, thank you so much for applying. But you're just not going to be a qualified. You have to meet my skill set. So whatever the job description is, you have to be able to meet those minimum expectations.
Sometimes we think that, we hear stories about, there's shortage in nurses in Canada, this province, that province. Maybe it'd be easier for us to apply and get a job. But then the reality is they actually do look at your ability. They look at your experience and any other things. And you can have a really high vacancy, but at the end of the day, we have to make sure that we have the right people looking after our patients to provide quality, safe care for patients. And you can be in a nursing shortage, but that doesn't mean we'll just take anyone off the street, right? That says that there's lots of nurses out there, but they're not always suited to the environment. Right. Even though you have an ICU experience in Korea, you don't want them to apply to ICU in Canada because you may have a different training and everything.
Very different training. Very different training. And I'll just, for that part, if you're an ICU nurse in another country, we almost wouldn't take you into our ICU directly. We'd almost encourage you to go to wards first to know what Canadian healthcare and how to manage, and then come to the ICU.
You're right. Perfect. That's very important, I think.
Yeah.
So last question. Is there a last thing that you would advise to future Canadian nurses in Korea?
I think, you know what? I think try to come to Canada. We're very fortunate in the world to have a public healthcare system, and although we're stretched thin, I think we have amazing opportunities for nurses here, and nursing in whatever facet you might want. So I think there are opportunities to either work in elderly, in mental health, in community versus acute care. There's lots of opportunities. You just have to figure out what your skill set and what you want to do. Once you're here, nursing is the sky's the limit for in terms of career opportunities.
Right.
Everything from, like I say, working for public health to small private clinics. So I think there's a lot of nursing opportunities here, and I think they're only limited by your imagination.
So there's many things that would be in your way. However, keep on trying.
Keep on
There will
trying.
be opportunities.
And I think it's worth it. You know, there's always challenges and roadblocks that are put up.
Of course.
But don't give up. Just keep pursuing. And don't forget to really reach out to the college and ask for help. Don't just applying, you know, and do nothing or unsure of the process. Reach out, because I think the Canadian provinces, they're looking, right? They're looking for people to come and how we can improve the process. Is it perfect right now? No. We know that.
You're right.
Will it get better? Let's hope so.
Right.
But if you don't reach out to people,
You won't get anything.
you won't get anything.
You're right.
So reach out, even if you're applying for jobs and you reach out to a manager and say, I'm trying to get to Canada. What can I do? You know, and they hopefully will navigate you to their HR department, who may navigate you somewhere else.
Oh,
So reach out, do the research, but reach out as well.
That's a great tip, and then I think the encouragement from you would be I think it's a very good motivation to the nurses in Korea.
Yeah.
Thank you very much.
Oh.
Thank you very much for your time, Chris. I really appreciate it. Thank you.
Oh, thanks for the opportunity.
Thank you.
And good luck. I hope we get some visitors to Canada that'll stay.
Alrighty, thank you very much.